all of these talk, most of them were with regards to whole body vibration, which is great. What about direct application of the vibration? And what we know, the first, I think first person who looked at this was Liu et al. In 2005. And he showed that direct application of the vibration to that specific muscle is actually would be more effective because of decreasing the attenuation of the whole body stimulation, which is when you stand on the vibration, by the time the vibration gets to your arm and shoulder, is decreased, it's attenuated. And with the handheld vibration or local vibration, you actually can use a little bit higher frequency. They came up that you know with the regular whole body vibration, maybe 60 50 to 60 start losing its effect, but with the handheld, you may still have a good effect with the 50 and 60 hertz of vibration. Vibration during passive stretching of the muscle increases the primary sensory ending response. Now, this is a very important one. The stimulation of the muscle spindles, primarily ending via combined vibration and passive stretch, provides a reflex increase in electromyographic activity. So even when the patient cannot do their stretch, let's say, and it's painful, and because of that they cannot, or they have an inhibition, when you apply the vibration to that, you actually get EMG response. And if you do it with the passive stretching of that muscle, guess what you do? With contraction and elongation, you get that eccentric loading of that muscle, which without putting too much of a pressure. And the eccentric loading, as you know, will cause increases the fibroblast activity, hence increases the ability of the tissue to take more load. So for this reason, we think that BMTX can be used in reducing recovery time when the athlete is still, or the patient is still unable to participate in full weight-bearing exercises or a strength training under considerable load. Right? We did a narrative review with one of my sports residents, Garmin, Darren Garmin, and so we did that, and it was published in 2018. We looked at the effect of local vibration, and we looked at all the literature at that time. And what we found out is that local vibration does show to induce beneficial changes in the muscle activation, stimulation, muscle strength, muscle power, and joint flexibility and range of motion. Okay, so all of those things that we said, now we can show that with literature shows that this is happening. In general, what we found, higher frequency. So there are studies that they use 300 hertz. And there were studies that they use 10 to 50 hertz. What we found out is that for the device with 300 hertz to get the same result, you have to use it for 30 minutes straight, whereas you would get the same result with the 10 to 50 hertz vibration in 2 minutes. Which one is more efficient? The lower frequency is more. And the fact that when you go over 60, you're actually going to enter the harmful effect of vibration. So that's the one that even though it showed that it is, but it has to have much longer time for the same outcome. So that's very important. And that's why when I made the, when I designed the Vibramax VMTX thumper machine that I'll show you later on, this machine, when I made this one, the frequency on this is 25 to 45 with different dials that you can use. And the depth of penetration is about 5 to 6 millimeters. So it will give us what we wanted. And as you know, we're going to go over this. We have done lots of work to make it ergonomic. However, you know, this disclaimer is that I have not received any payment from from Thumper, even that I was the inventor of this machine. And later on, they changed the name to Verb now. So Thumper Verb, and I have a picture of that. Again, I do not get any residual or have not received any money